The views and comments of the hosts and guests are not necessarily those of the station.
Hi, I'm Nicole Jacinto. Join us on Healthline with 𝗏𝗏𝗶𝗏 as we discuss the latest health and medical topics with doctors from 𝗏𝗏𝗶𝗏. For a healthier and uplifting lifestyle, tune into Healthline with
Facebook and YouTube. Listen and watch on your mobile devices. Just search DZRJ Radio Bandido.
You're about to experience Healthline, a show where doctors from 𝗏𝗏𝗶𝗏 interact with you for a healthy, uplifting lifestyle. Moderated by Nicole Jacinto. You've got questions, we've got answers. So welcome to Healthline.
Hi, everybody, and welcome to Healthline with 𝗏𝗏𝗶𝗏. I'm your host, Nicole Jacinto. Just a disclaimer for today, in case my voice is shaky or I cough a bit, I'm just going to have to go on mute for a bit because I'm still recovering from an illness. Today, we're going to talk about CPR. That's really important. And with us is Dr. Mark Paul S. Castillo. How are you doing, Dr. Castillo?
Good afternoon, Ma'am Nicole. Good afternoon to all the viewers.
Oh,
We're good. We're good.
okay. Yeah, I thought I was gonna have to rush someone to your emergency room earlier, but it also made me a little nervous. Like, oh, the show, the person, But I mean, perhaps I was just nervous. Anyway, so yeah, sometimes we share spontaneous things like that with our viewers because this is a show that has nothing to hide. In fact, there's a lot to learn and a lot of knowledge and a lot of information to gain by listening to the show. And you can listen to it over and over again if you want on our streaming platforms. We are not only live right now from Metro Manila. We can be seen on the DZRJ 8:10 a.m. Radio Bandido YouTube channel, and as well as on our Facebook. I have a member here who's like laughing. A member of my home audience, which is like my dog, she's actually laughing at me. She's like, okay, so doctor, putting myself in good spirits, isn't that also good for recovering when you're recuperating? Okay, we're going to talk about CPR. So that's cardiopulmonary resuscitation. Can you tell us first, doctor? I mean, let's start with what is CPR?
Okay, so CPR is the acronym for cardiopulmonary resuscitation, as you mentioned. It is an emergency procedure in which it's a life-saving procedure that is employed when the heart stops beating.
Okay.
So it somehow simulates the pumping or giving of blood to the vital organs such as the brain, the kidneys, the heart. No, so when you do cardiopulmonary resuscitation, you are somehow mimicking as if there is a heartbeat.
Okay, you're mimicking the heartbeat. Okay, I'm gonna ask you a question later, but maybe after your, I don't know. I know you're gonna demonstrate for us today, right?
Yeah.
Alright, great.
We have here dummy and we'll demonstrate for the viewers as well.
That's great. That's great. I'm sure some of us have seen that on TV or whatever, but it's best coming from a doctor and an emergency medicine specialist like yourself, Dr. Castillo, who practices, of course, in the prestigious Makati Medical Center here in the Philippines. Okay, so doctor, why is it called cardiopulmonary exactly? Well, is it because of the area? I mean, the cardio for the heart and pulmonary for the lungs. Can you just maybe some people are into words and stuff would.
Yeah, because cardiopulmonary, you are right. It is cardiac for the heart and pulmonary is for the lungs. Because when we look at the history of CPR, sometime it started in the 16th century when it was not yet that scientific. No, they try. The focus during that time was giving air or giving ventilation. So because the first victims or the first patients for this kind of procedure are patients who have drowned.
Yes.
So basically they give resuscitation by giving air. So it was just in the late 1900s or 1960s, when the American Heart Association was actually formed,
Mm.
and they combined the there are, I mean, in the early 1900s, there are cardiac compressions being done.
Mm.
But in the 1960s, dun yung kinombine nila,
Fine.
both the chest compressions and the ventilations. No,
I'm
so
so
it
glad.
has, yeah, it has undergone a lot of a lot of changes. Like you will hear, or when you Google it, some will say ABC, airway, breathing, circulation. Then later on, naging circulation, airway, breathing.
Mm.
So it changes because the evidence suggests that there are some instances na talagang the priority is actually the circulation, the priority is actually the airway. No? So currently, in the recent guidelines set by the American Heart Association,
Mm.
it's circulation, airway, and then breathing.
Okay, circulation, airway, and then breathing. So, all right. I know you're going to demonstrate it, and as I'm so glad you mentioned the history of it and parts of the history, because it has been, as you said, developed over time, and like the kind of where it is now is a bit it's fairly new. Like it's so
Yeah.
basic, but it's fairly new in terms of modern medicine when it comes to that. And you said like some of it started with, I mean, like the form that we know it as today started with drowning, with victims were drowning, and then probably like 17 something, like they would talk about more of the airway, getting people to breathe, because when you drown, like there's water there and you can't breathe. And I remember when we were kids, we had these toys. Every like family used to have a doctor kit set with the
Mhm.
the you still wearing that I don't know what it's
Yung,
called actually. Yeah, that one. We can only do hand gestures because I really don't know the name. And then like you lower it so that you can see better. Like you focus through it, and then there would be a stethoscope, and then
mhm.
it would come in this bag, that looks the same like the traditional doctor's kit. And then I remember there was this thing that came with one, and it was like a pump. And then
Mhm.
I think it was an older sister of mine who said that's for like you put it in your mouth to like you press it to,
Oh,
yes.
the bag valve mask. Yung parang the brand is Ambu bag, I think. Yung
Ah,
parang bag, yung ganun po, or yung mask.
it was not a mask. It was just a kind of pump. Maybe she was just pulling my leg and trying to get me to put the pump in my mouth. Now that I think about it, okay. Yeah, we did a lot of stuff like that when we were kids. But basically, yeah, she was, right. Like they were trying to get people to breathe. And
Mhm.
okay, so let's go back to the main topic at hand.
Sorry, if I may share, no. So in before year 2008, the concentration was for healthcare workers to be adept to having resuscitation, no. So I to perform CPR. In 2008, it used to be called bystander CPR.
Oh yeah.
So the bystanders are
Mm,
encouraged to perform CPR.
mm.
But in the recent guidelines, it was changed from bystander to lay rescuer.
May rescue.
Interesting yung reason, because when I'm reading about it, bystander, the connotation is you stand by, so you
Mm.
do nothing because
Okay.
you're a bystander. But for lay rescuer, or lay people who are actually trained or are encouraged to do CPR, parang there's more active role or active word for it. That's
Yeah.
why it was changed from bystander CPR to lay rescuer CPR.
You agree with that change of words? You don't have to answer that question. Okay. It's just all right. I mean, oh, apparently when I do something or move further, my camera blinks. Sorry about that. Okay. now it makes me think of people who are not nuns or priests when you say lay bystander. I mean, lay resuscitator.
Lay,
Was
lay
it
rescuer.
lay rescuer? Okay. Okay. I guess because for me, bystander is like, I guess anyone who's on hand, but
Mm-hmm.
it's like a more passive word. So,
Mm-hmm.
okay. Lay resuscitator. That's harder to remember. I'm a lay resuscitator. I'm a lay resuscitator, but who am I to disagree with, maybe
Yeah,
it's
yeah.
my 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 time on this earth showing where oh my gosh, we got used to one term. I mean, some terms need to be changed. I truly believe in that, but that one, I'll leave that to the experts. I don't want a word war with any. That's why I don't have to answer the question, doctor. But okay, so if we hear someone say lay resuscitator, that's the
Or
same.
lay rescuer.
Oh,
Mas
sorry,
madali.
yeah. Lay rescuer. Okay, lay. I'm gonna write that down. Lay rescuer, and try to remember it. I'll just I know they've like they would encourage us like and demonstrate when we were at certain places when we were younger. They would encourage people and maybe parents and especially parents or all of that or teachers or to know how to do CPR or at least the basics. But I'm sure you can give us like an outright and better demonstration today. But doctor, before you demonstrate actual CPR and how it's done, can I ask you, when do you know or when should you actually give someone CPR? Because you might overreact or you're not sure exactly when or should you sometimes well, a lot of times you get flustered and then you're like, I can't get a pulse or this person seems to not be breathing. And then we see those old detective shows where they put a mirror under the nose to see if they're breathing, right? And so,
Mhm.
I mean, what kind of combination or in what instance do you actually apply CPR? Like, um, when is it best to do it? And then some people say, no, don't touch the person, wait for a medical expert to get there. But sometimes the point is you can do it if you know how to do it, or if you wanna well, we'll talk about the risks later, but you're
Mhm.
going to demonstrate today, and that's at least if you see a doctor or someone else doing it, a medical professional, then you'll understand why they're doing that to the person. Okay.
So basically, the question is how to recognize it.
Yes. Okay.
That's a very important factor when we do CPR. No, so hindi naman lahat ng hinimatay you'll do CPR agad, 'di ba? Tama ka rin. You might sound or you might look overacting kapag ginawa yun, no? So, there are in the recent guidelines, there are only two requirements for lay rescuers to look at. First is that the patient is unconscious or the patient is not responding. So when we say not responding, even to voice, even to tapping or shrugging, the patient does not respond or the victim does not respond. That is an unresponsive or an unconscious patient. That's the
Okay.
first. The second is the patient is not breathing or not breathing normally.
Breathing normally. Okay.
So you'll see makikita mo yun that the patient is actually not breathing or parang sometimes may gasp or agonal gasp. It's not a normal breathing pattern already. So pag ganun, a combination of an unconscious patient or an unresponsive patient and no breathe and the patient is not breathing, you may start doing
Okay.
CPR
Okay.
already. Before, they require pulse check. Mhm. So, but when they studied yung apprehensions ng lay rescuer into performing CPR is di nila sure if may pulse or wala. So
Oh.
it's a skill that has to be learned doing pulse check. So they removed it so that wala ng apprehensions yung lay rescuer to do CPR.
Yes. Thank you, doctor. Because before I do remember that they'd ask you to check if there's a pulse, and then there's still a pulse, but they don't seem to be breathing. Should I do it or should I not? So as long as a person is, the two requirements you said, the main requirements are that they're unconscious, or they're not
Mhm.
responding, they're not responsive, the patient is not responding or not responsive, and that they're breathing. Are there, you can tell they aren't breathing, or they're still breathing, but it's like an erratic
Gas.
kind of breathing. They're gasping. You can tell they're gasping for air.
Mhm.
So as long as those two requirements are met, and of course, when you did mention earlier, like through voice, like, "Are you okay? Are you okay? Wake up," ganyan. Or, and I know a lot of people tend to slap the face of someone a little bit,
Yeah,
to see if they will
that's
wake up. Mm-hmm.
mm. That's actually employing tactile response din eh. So when you tap, sometimes hindi kasi natin alam kung yung victim is actually deaf on one ear or on both ears. So aside from the voice na, hey, hey, are you okay? You also tap na,
Yeah.
so that the patient or the victim would respond.
Yes. I've been slapped before in a situation where I thought I was unconscious. Okay. My an EMS, so or an EMT, an emergency medical technician. So yeah, like, to wake you up, to see, to check, and maybe if you have any flinching or any reaction. Okay.
Mhm.
So anyway, I can say that I experienced, and so don't do what I did, which was like, don't touch me. Okay. So anyway, I made friends with the guy, but forgot his name many, many years ago. So, doctor, those are the two main requirements. Okay. I just want to emphasize that to the audience, that if the person is unconscious and unresponsive, and you can tell they're having trouble breathing, or it seems that they're not breathing, and
Mhm.
the reason for the you can take the pulse, but you don't have to wait for that to see if they have a pulse or not, because a lot of people who hesitate because they can't feel the pulse might be too weak, or sometimes if you're not a medical professional, you may be panicking. Is that mine? Is that the you press
Yes.
deeply, then you won't feel it, whether you press on the wrist, the neck, you just freak out, and so I mean, to be sure and to make sure, there is more good than harm in simply not not caring, but it's not as important to take the pulse anymore. It's
For
not a
lay, yeah, yeah, for lay
only
rescuers.
rescuers. Okay,
Mhm.
yes, because medical professionals would be really adept at taking the pulse and skilled at it, and finding, really being able to detect it.
Mhm. If I
Probably.
may share, sorry, if I may share, when we train healthcare professionals, it helps kasi when you place it in acronyms, no? So, um, when I remember how to do CPR, or when I recall how to do CPR, I always bear in mind na during that moment, panic mode, hyper mode. So
Yeah.
my acronym for that is, actually, I borrowed it from one of the training centers. The acronym for that is hyper. No,
Okay.
so H is for checking for responsiveness, like, hey, hey, are you okay? So
Mhm.
that's H. Y is you are yelling for help.
Yes.
Um, you should yell for help. You know why? Because when you don't call for help, you don't call 911, you don't call 168 in Makati, or you don't call any emergency number, help will not arrive. So it is important that you call for help. I
Mhm.
read one anecdote about that, calling for help,
Mhm.
in the Philippines, or I think in any setting, when you see a person collapse, and then some good Samaritan or a lay person is doing that,
Yes.
and then you call for help, suddenly all of the people around you will look the other way around.
Ah,
Parang tatalikod sila, 'di ba? Usually, I mean, instinct 'yun na parang nakakatakot mag-help. So the way to do that, or the way to address that, is, you as a, let's say, trained ka, or you want to call for help, you identify the person. For example, you wearing black shirt, or Kuya Guard, can you please call 911 for me, or can you please call an ambulance for me? At least that person will know na, oh, it's my responsibility. Ako yung pinausap niya, hindi yung tulong, tapos lahat ng nasa paligid mo will just turn their, so yun yung iniisip ko, one way of sort of parang
Really good, doctor, because it also like people might wait for each other. Oh, you be the one. Oh, you be the with all being stunned, and if you identify someone, they'll know. Okay, I'm the one who's supposed to do it. And also someone whom like I don't know what to do, but I can call.
yes.
How to call or bilis-bilis tawagan mo, then people can start you know helping each other or finding someone who knows who to call or who can call.
Mhm.
So that's great, doctor. Those are great tips. So that's the why, the yelling.
Yes, the P is for pulse check, but we don't do it nga for lay people. E is for emergency response, so yun yung 911. And R is for right CPR. So later on, we will be discussing ano ba yung right CPR. So yun yung hyper. You check for responsiveness. Hey, hey, are you okay? You yell for help. For trained, you check for pulse, call the emergency, and then you do the right CPR. But to sum it up, the patient should be unconscious and the patient should not be breathing before you do it.
Yes, thank you, doctor. That's very clear. Thank you for going through that very clearly and for giving us tips. I mean, the yelling part, what you mentioned is really important. That if you can identify someone, and not just rely on. Sometimes there's paralysis when there's a lot of people,
Yes,
or yeah, or especially nowadays. I'm sorry, but especially nowadays with their phones, like you're like, oh, I'll just film it. Often when I see stuff like that, I'm like, why don't you help them instead of just filming? But there is always someone in the crowd who does help, and filming things can be important. Um, but it's good to say that. So it's good to identify someone, you in the black shirt, or as you said, Kuya Guard, or Sir with the white car, or whoever, so that they get it. The people that you're calling out for help to also get it, and they don't just like bottleneck, because we also have a tendency to do that. We like to watch scenes that are dramatic, but we can't always just be watchers. We can, or we don't only have to be watchers, or you know nowadays with the phones, it seems that everything, like, it's so funny how we get to document the smallest or biggest or most dramatic things, but somebody should help also, not just by filming it, but by calling up for help already. So thank you, doctor, for that. That's a really, really great point you made. And I think I'd like that to, stick in people's heads about calling out and making sure that whoever is around, can really help you also help the patient or the person. So, okay, doc, would you like to how exactly, so let's get to it. How exactly do you conduct CPR? Would you demonstrate for us?
Okay, so before we demonstrate it, let me have just some pointers. No, so
Sure.
in lay rescue CPR, there are just two things that you should do. You call
Yes.
for help. You call for help, and then you push hard and fast on the center of the chest. So when we say we push hard, we need to quantify how hard is hard. No? So the AHA guidelines say that it should be at least 2 inches. But honestly speaking,
And like
who
parang
will
push 2 inches down. So like
2 inches down? So mga ganun
thumbs neck.
kalalim yun. But who brings a ruler with him
Yes.
anywhere, di ba? So the dictum is just you push hard.
Okay, you push
Okay?
hard.
You push hard. You push fast, meaning that the rate should be at least 100 to 120 per
Okay.
minute. So doon meron tayong pwedeng gawin. One is you can download a metronome on your phone.
Yeah.
So a metronome is set to certain beats, 'di ba? So like you set it at 110, then then you follow that rhythm. Some actually in one of the streaming apps, na music streaming apps, there's a playlist for AHA songs that are between 100 to 120
120 beats per minute when
beats
you.
per minute.
Okay, sorry, I'm tapping on the, like it will basically a metronome sounds like this. It's a guide and it can go slow.
Not sure if you can
Fast.
hear. You have that.
Okay, it's all right. Can you hear this, doctor? Can you hear this tapping? I'll just. Okay, so I'm tapping on my desk. Hi, it in the studio. Can you hear me? Is it heard? Okay, no. Yes. Okay, sorry. Yes. Okay, so the studio can hear it. So I'm assuming the audience can hear it, doctor. If it's like a metronome is something that just holds the beat,
Hmm.
and of course the beat can go faster or slower. Okay. So there's a playlist of songs you said that you can download. And I want to ask about Staying Alive because a
It
couple
is it
people
is
told
in
me
100 between 100 to 120, pero baka yung Gen Z would not know Staying
I
Alive.
know.
So
I'm gonna
there
ask you
are
about that.
Imperial March of Star Wars is between
Ah,
100 to 120.
is that the
And that one.
okay? Because Staying Alive is like, and I remember, we get. I mean, Staying Alive is this song though. Okay, for people who know Staying Alive, it's a song by the VGs, and it's VGs tuloy. Ano ba yan? VGs. That's what I get for making fun of people. Always gets me on the air. Karma goes very fast. Okay, so Bee Gees, no? So there's groups, it's vocalization, but that was a hit, kids, in the late 70s and early 80s. And a lot of people still know it. And it's that, it's such a vivid song. And then the voices are also like mimicking the beat. And there's that, you hear the bass like, down, 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 down. What's important there is the beat, because I remember somebody asking me once, wait, which one am I supposed to go to? The turn and there. It's like it's actually the same. It's turn and there, and then it's like ha, 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 staying alive. I'm sure people are laughing right now, but so that's the one that we followed. Okay, so those who remember Staying Alive, it's the ha, 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 ha. Don't do the turn and there, kind of beat. It's already like almost the melody because it's so intertwined in that song. It's so rich, and everyone who knows the song remembers it. Even if you don't know all the words, it's there.
Mhm.
But as you said, the Imperial March for Gen Z in Star Wars, okay, which
Mhm.
is
There are
actually
a
old.
lot actually, which is actually old, yes.
Yes, there's a lot. Any like Gen Z songs, any Gen
Yes.
Z songs, any Gen Z songs that
Sorry, I'm looking at
sure, okay, no pressure. Um,
yeah, Staying Alive. Call
and
Me Maybe by Carly Rae
yes, I
Jepsen.
can see that. Yes,
Mm.
oh, maybe. Okay.
Sa 90s, Wannabe by Spice Girls.
Okay, yes.
Uh,
Wanna be
Macarena. Those are songs na uh,
of course, I have to
it's
sing
between
along with every
100.
song that you mentioned.
Actually a lot. So I mean,
Yeah,
when you hear it and then you recall na ganito nga yung beat nun. So it's not advisable naman na you play the song while doing
oh,
CPR. Pero at least in your mind, it's
your mind.
playing.
Yeah,
It's playing, and then so you are in the 100 to 120 beats. So
especially if you're like a drummer or a
or a
rhythmic.
musician,
Yeah, then
you know the beat.
yeah, you know the beat. But a lot of people, just music lovers. The drummer, kasi it's like the metronome. But okay, so there we go. I feel like I.
Sorry. So push hard, nawala sa nawala.
Nawala sa yeah. But it's okay.
So
I mean, everybody can relate.
push hard and then push fast.
Push hard and
So
push fast.
other tips I'll be showing on later, and
Okay.
I'll be doing it so that you don't do it. Parang ganun.
Okay. So that I don't have to demonstrate it, which I can't do. And I understand you have a dummy and everything, so that's
Yeah.
fantastic. Okay. So while you set
Okay.
up, doctor, um, if you'd like to set up now,
Yeah, I'll set up.
all right. Okay, doctor. So, while you're setting up, I'll just make a couple of announcements. Okay. So, folks, um, AJ, do you mind playing the yeah, there you go. Okay. All right. That is, as you can see on screen now, folks, Makati Med is having free breastfeeding consultation. So that's happening this week actually from August 6th, that's tomorrow, Tuesday, to August 9, this Friday. And it's from 10 a.m. to 1 p.m. That's the time that lactating moms and pregnant women can drop by the breastfeeding room at the third floor of Makati Med Tower 1 for their free breastfeeding consultation. So the lineup of the doctors for this week, it's hashtag International Breastfeeding Week program. That's hashtag International Breastfeeding Week program, and that's from Makati Med. That's being given to it's open to the public for Makati Med. It's free breastfeeding consultation, and it's with Makati Med lactating experts. And this is for pregnant women and breastfeeding moms. They have a lineup on August 6th. It's Dr. Catherine Ong Shangsheng, and on August 7th, it's Dr. Anne Lorraine Gochinko. On August 8th, it's Dr. Teresa Ribaño, and on August 9th, it's Dr. Annalisa Gabriel. So the doctors will be waiting for you between 10 a.m. to 1 p.m. from this coming Tuesday to this coming Friday. And that's on the third floor of Makati Medical Center, Tower 1, or Makati Med Tower 1. 10 a.m. to 1 p.m. Don't forget that and you're encouraged to go. This is again this Tuesday to this Friday, August 6, 7, 8, and 9. So you've got 4 days to go and get a free consultation, a free breastfeeding consultation with Makati Med lactation experts. Okay. And of course, this event is made possible by the Department of Pediatrics Breastfeeding Committee in celebration of the International Breastfeeding Week. Okay, so thank you to the Department of Pediatrics Breastfeeding Committee celebrating International Breastfeeding Week by giving people free consultation, or I mean, rather giving pregnant women and breastfeeding moms free consultation. I'm sure that if you want more details, you can go to the Makati Med website. And if you have questions like you'd like to call in and ask, oh, can I bring someone? Da, 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 because they can answer all of your questions, and you can call Makati Med and visit their website for more information on that. Okay, I think the doctor is ready to show us. Setup is done. So thank you, AJ. And we go back to doctor now. All right.
Yes. Hello. Yes.
Hi,
Okay.
doctor.
Hello. So this is Resucian. So this is the resuscitation mannequin. No? So we'll be demonstrating how to properly resuscitate. But again, you recall that first the patient should be unconscious and the patient should not be breathing. So how do you check consciousness? As mentioned earlier, H is for hey, hey, are you okay? So you tap the patient's shoulders. Hey, hey, are you okay? Hey, hey, are you okay? So while tapping, you are also shouting at the patient. If the patient responds, then the patient is not unconscious, no? So or the patient is conscious. If the patient does not respond with tactile stimulus and with verbal stimulus, then you assume that the patient is unconscious.
Okay.
Okay. Next thing to do is you check for you call for help. So
Mhm.
why? Yes, you call for help, and then P is for layperson, you check for pulse. But P is for healthcare professionals, you check for pulse. But for lay uh, rescuers, you check for breathing.
Okay.
If the patient is breathing or not breathing.
Okay.
Okay, so while checking, where do you see that? You will see a chest rise if
Mhm.
the patient is breathing. No, so if there is no chest rise, then you assume that the patient is in cardiac arrest. So you have to do CPR. Okay. Again, we call the emergency response. You ask someone to call for 911 or an ambulance, but you, the rescuer, should do high quality CPR. When we say high quality CPR, what's the first is push hard. Okay. So when you push hard,
Mhm.
okay, at the patient at the center of the patient's chest. So
Center of the
chest,
chest.
center of the chest,
Mhm.
then push hard. Then you push fast at a rate of 100 to 120.
Okay.
As you notice, yung elbows, hindi siya
They're not.
nakalock siya. It's locked so that you'll have the force
Mhm.
to the patient, not to the patient's chest. And as you notice, kung pa-side view,
Mhm.
it's almost 90 degrees dun
Yeah.
sa
Body
patient.
is at
No?
almost
So,
90-degree angle.
so hindi siya ganyan. Like, pag pinupush mo kasi ng paganyan, it will not give effective circulation. So you'll have to lean forward para magkaroon ka ng 90 degrees to the plane of the patient.
People sometimes sorry, I'll let you finish before I
Yes.
ask.
Okay, sige po. So, it's 100, as mentioned, you push hard, push fast at 100 to 120. So ako, yung ginagawa ko is I count out para alam kong nasa 100 to 120 ako. Because when it's fast,
Mhm.
I didn't finish the counting. Most likely it's more than 120. That's for me, no? So may kanya-kanya namang style on how you will make sure that you are in the 100 to 120 mark.
Okay.
So, okay. So in the lay rescuer, you just do this until help arrives.
Okay.
Approximately, it's 2 minutes before ka mapagod. So actually, in one minute, 1.5 minutes, medyo pagod ka na doing this. Then someone can actually do CPR for you.
Yes, you
You can
can
switch.
switch. Okay.
You can switch with someone when you are already tired.
Okay.
So always remember na you don't not to lean excessively to the patient. Yung nakaganyan ka na halos hindi na siya umaangat.
Don't put
I
all of
think
your weight.
they can see naman yung pag-angat ng mannequin.
Yes.
That's the recoil part.
Okay, doctor. What you did, I'm just gonna try to describe it and just jump in anytime and correct me if I'm just gonna try to describe it for those of our listeners who cannot see,
Mhm.
as best as I can. Um, so we saw the being unconscious, the person is lying down, and should you make sure they're flat on their back? Yes.
Mhm.
Okay. Okay.
Yes.
Then you put one hand on top of the other. Let's say
And
you
then lock it.
and lock it. Okay, so one hand if you're if you are right-handed, should you use your right hand on the chest or put it on top of your left hand?
Whatever is more comfortable. So it's either left over right or right over left. It's okay.
And
It
then
won't matter.
lock it so it's one steady push, no? And then we saw you leaning over the rescue dummy. So you will you will lean over the person and right at the center of the chest start pressing. And as you said, you don't put all of your body weight, but you're
Mm-hmm.
leaning over and you're not too far away either because that
Yes.
may not have enough force. And then we saw you locking your elbows and making it straight, and as you said, you're almost at the 90-degree angle, and then you just push based on the you push, and you count. You said that you can count out loud also, because if you find that that is a good point, doctor. It's a good tip, because if you can't count, like if you can't count it, that might be faster than between the 100 to 120 beat per
Yes.
minute mark. Okay.
Mhm.
So there, I mean, just jump in and correct me anytime if I'm wrong, or add anything you want. I'm just describing it for those in our audience who can't see. We have a lot of people who do listen to us, and thank you for tuning in, no, and especially to a show like Healthline with Makati Med, where you can learn a lot of things. Okay, so thank you, doctor, for demonstrating that. And also,
Okay.
notice your dummy is a male with like a male profile. So,
Ang female.
ah,
Female
as
po
male?
yata siya.
Okay. Sorry. Okay. Well, I guess her chests are as flat as mine. I'm just kidding. Okay. Um, I said chest. I didn't say, any other word. But okay, so basically, let's not be jahe. My point there was, let's not be jahe. If you're gonna do this, commit to it, guys. Don't, don't be like, oh, I don't want to touch her, her breasts or anything like that. You're saving a life. That's what you're doing. As I know in our culture, we kind of like, sometimes we overthink a lot of these things. And do you find that, doctor? Have there been people like, ay, ayokong hawakan kasi nakakahiya, babae yan, ikaw na lang.
Yeah.
Yeah.
That's an interesting observation. In a 2023 study by the AHA, they said that for out of hospital cardiac arrest, it's more likely that men will receive CPR from lay rescuers than for women. Kasi nga, it's the anatomy, it's the yung they don't feel comfortable doing CPR. But as you mentioned, when you know that you can do it and you commit to it, you just commit to it. There's no male and female in this situation. Although it plays a role, or it plays some people will be hesitant to do it to females. But actually, your observation is correct. No, sa men are likely to receive CPR in out of hospital setting.
Yes. Thank you, doctor. That was great. Your demonstration was fantastic. Are you tired now from pumping, or you, that's like okay. So, doctor, okay. Thank you for demonstrating that to us, and also, for showing us, for describing it, the way you talked about it and the way you speak about it. It's very, very rich information. And I asked you about staying alive, and you're like, yeah, the Gen Z might not know. That's a good point, doctor. Okay, doctor, now that you've demonstrated, can I ask you a few questions that came to mind earlier? A lot of people, like, not a lot of people, but some people that I know, they tend to, like, their stomach also rises when they breathe, or they do this like breathing. They want to breathe through their stomach and not through their chest. I don't know what, but you see the stomach rise more when someone is unconscious or gasping for breath. Does the body automatically, like, is it the chest that will really rise? Is it-
That's the usual thing. I agree to your point na there are people who are abdominal breathers, but when you have no respiration or no ventilation at all, both the abdomen and the chest are flat, so they will not rise.
Yeah, when
Um,
gasping for
when
breath.
we, yeah, when we do abdominal breathing, it's sort of an active procedure. I mean, an active effort on our part on the so hindi siya yung normal na it's the chest that's rising. You'll need extra muscles for the abdomen to rise. No, so when a patient is unconscious and is in cardiac arrest, all those muscle tones will just simply go away. So you will not have any chest rise or abdominal rise for that
Yes.
matter.
Okay, thank you, doctor. Because the abdominal breathing is something that's a very conscious act that you're training
Mhm.
yourself to. You have to think about it. You have to kind of command. It's not automatic, but if you just were to breathe normally, it's automatic that your chest will rise. And so if somebody's like, that's why it's the chest that you monitor, whether they're gasping or not. Okay, and then thank you again for the acronym, the hyper, and then call for help when you're yelling. And if you happen to like, I saw you tap the shoulders, like, hey, are you okay? And then you did mention that some people can't hear. Does
Mhm.
tapping the shoulders also like really help in terms of I'm tapping my shoulders now, but does it, or the front of the shoulders? I don't know what you call this part, but is that the best way to like shake someone, or give them tactile get
I Yeah, I think that is the most accessible when you do, kasi you will be shouting on both ears. So yun yung pinakamalapit mong itatap. No?
okay.
So that's why it's the shoulders. I guess yung tapping or slapping of the face, it has negative connotation kasi. So I think the better area of the body that you should tap are the shoulders.
Okay.
I'm not sure about the sensory,
Yes.
the sensation on those areas, but the idea is you employ as many senses as you
As
would,
possible.
like shouting, and
Touch.
tapping the patient or touching the patient.
Okay. And then doctor, if like even before the resuscitation or while you're doing the CPR, the person wakes up, should you stop?
Yes.
Okay.
The patient who is moving or who is talking to you na parang, wag mo akong,
Yeah.
or parang pumapalag is actually alive. So you stop doing CPR.
Okay. So like if they suddenly shout, ano ba? Di ba? Because sometimes people will be like that. Like if you're shouting at them, like parang they were unconscious, but you were able to wake them up. Or they go, ang baho
Mhm.
ng hininga mo, or something like that. Then you would know that they're alive.
Yep.
Right. Okay. How come there's no more breathing involved, doctor, for those who are not medical professionals? Like I remember before they used to tell us to like lean the head back, clear the airway and all of that. Is that something that medical professionals do? Those who are
Okay.
trained.
So before mouth to mouth resuscitation was a thing, no? So but in because of infectious risks,
Yes.
especially during the times of COVID, it
Yes.
was not encouraged for lay rescuers to do mouth to mouth resuscitations. Even healthcare workers during that time, they don't do mouth to mouth resuscitation. What
Yes.
they do is bag ventilation or bag valve mask ventilation. Okay. So yung
That's
pinipress na,
yeah, the one that you press. That's
and
what you're
then
talking
there's a mask on the patient, so
about.
that will deliver the ventilation part.
And
It Interestingly, when they studied, we call it hands only CPR, so there's no mouth to mouth resuscitation. When they studied those patients who underwent hands only CPR and those that underwent ventilation, sa first minutes of arrest, the more important part is the compressions. That's
compressions.
why hindi siya in-emphasize sa lay rescuers to do the mouth-to-mouth resuscitation. So when emergency medical team arrives, then they'll do other stuff like give breaths and provide yung i-attach sa AEDs. But when you are sure, for example, wag naman sana, but it is someone that's close to your heart, alam mo namang wala ka makukuha sakit, then you can give breaths after every 30 compressions. But for uniformity, what we teach for lake rescuers is to do the hands only CPR.
Okay. Okay, thank you, doctor. Yes, especially after the pandemic and like communicable diseases, it's really a thing. But as you, thank you for saying that. Wag naman sana, but if it's someone you know, your family, someone you're even kissing, perhaps, then then you can do the mouth to mouth resuscitation. And how do you do that again? You gently lift their head. Oh, you don't
You
want to do it.
gently.
Not recommended. Okay, or can be. Okay, that can be. And of course it would make sense that you already did say that they found that the pressing of the hands and that kind of stimulation is more effective. It's the more important one rather than giving your breath to theirs, which is actually like, I mean, literally giving them breath, or trying to put air in their through their airway or their back into their lungs. And of course it would make sense that if you are a lay rescuer, you may not be going around carrying a valve, right? I mean, who goes around carrying a valve, the breathing bag and the valve. So of course when the medical professionals get there, they have this with them because they're stocked up with all the equipment, including the paddles. Okay, doctor, maybe we can just take a short break and then I can ask you some more questions and you can, of course, talk about whatever you want. Just a very quick break to show just some more features that Makati Med has. We'll be right back, folks. Take a short break, AJ. Thank you, doctor.
You're listening to DZRJ 810 AM. We'll be right back after these reminders.
Hi, this is Dr. Jacinto from Makati Medical Center, and I'm happy to share that our world-class quality healthcare with the heart is now more accessible and affordable through Makati Med Care Access at 𝗛𝗶𝘁𝗵𝗹𝗁. Available for outpatient care services, our 𝗛𝗶𝘁𝗵𝗹 site offers consultation and diagnostic procedures such as medical assistance, hospital admission assistance, blood pressure monitoring, laboratory tests, and X-ray, among others. This is really convenient for those residing in Makati and nearby areas who do not want to go to the hospital to have these treatments and procedures done. We believe that access to excellent quality and compassionate healthcare is a basic human right, and we at Makati Med 𝗛𝗶𝘁𝗵𝗹 are doing our best to make this possible to more people. We are open from Monday to Saturday at 8 a.m. to 5 p.m. at the third floor of 𝗛𝗶𝘁𝗵𝗹 in Makati City. For inquiries, you may reach us at these numbers. We look forward to serving you here at Makati Med Care Access 𝗛𝗶𝘁𝗵𝗹.
You're back with Healthline, keeping you healthy. Moderated by Nicole Jacinto.
Hi, everybody, and welcome back to Healthline with Makati Med. We're discussing CPR today. You saw a great demonstration from Dr. Castillo here. He's an emergency medicine specialist practicing in Makati Medical Center, of course. And he showed you everything. We described it as much as we could. And he gave you so many tips on how to perhaps perform CPR better, especially if you are a lay rescuer. Now, earlier doctor told us that a lay rescuer is someone who's not a medical professional, but has been trained in CPR or can do CPR. I mean, and who's done it or maybe has to do it again. Wow, these people, no, it has happened though that I know a person who has done CPR more than once. So and it might happen to someone that you just see, someone you don't know, whether it's it's someone who's there. If you are going to take an active role, what doctor showed us earlier, what he demonstrated, and the things he said are really, really very valuable. I really have to thank you for that, doctor. I'm glad this can be a platform to spread the right way to do CPR. And you did mention that right CPR. And okay, so doctor, just question out there, like if a medical let's say you came along and you saw, they didn't know you're a doctor, but you see someone who falls, would you and you didn't have a bag with you, would you give mouth to, well, not you personally, but do you think some medical professionals still do that, like they give mouth to mouth resuscitation because it's something they're used to, even if they know the risks?
Yeah, I think depends on the situation. Like, for example, you see a patient who drowned.
Yes.
Basically, most likely those people will still give mouth-to-mouth resuscitation. So it's a risk that they are somehow willing to take when they do mouth-to-mouth. I'm not saying that you do not do it, but it's really you weighing the risks of that procedure. It's not naman bawal to
Yeah.
give mouth-to-mouth resuscitation, but if you think the person needs it, then it's okay.
And doctor, also, like, if like right now, because I'm still getting over something, it's not COVID, but I wouldn't want to give someone that I care about, unless, the yucky scenarios some sometimes think of. But even someone I don't care about, I wouldn't want to get them sick with doing
Mhm.
mouth to mouth. And I mean, not only
Mhm.
thinking of myself, but thinking of what you can spread if, like, you're hacking and coughing. Okay, doctor. So just some quick questions. Can anyone learn CPR?
Yes, there are training for non-medical people or lay rescuers. So there is in the website you can look for American Heart Association CPR in your area. It's called Heart Saver. That's the training module for non-medical CPRs. No, so there is. There are nationwide trainings, especially last July 17. There's a nationwide training from Philippine Red Cross, from the Philippine College of Emergency Medicine, and other stakeholders who want to promote lay rescuer CPR.
Okay, and then doctor, just to, before you give advice to those people who want to learn CPR, can I ask you, are there any risks to either the person giving CPR, probably, the communicable diseases,
Mhm.
that if you give the mouth to mouth resuscitation, but are there any other risks, and even for the patient perhaps who is receiving CPR?
For the patient, there are minimal risks. Like, for example, if you push too hard, you might end up having broken ribs. But these are non-fatal complications. No, so that's why it's encouraged. Na if you don't know how to push hard, you just push hard. If you hear some crackling of the ribs or cracking of the ribs, don't be parang ay na
I'll
parang
stop already.
I'll stop already. No, so these are non-fatal complications. Even medical professionals, they puts the patient at risk for those non-fatal complications. For the lay rescuer, it's himself. There are a lot of you just need to be prepared both physically and emotionally. No, I'm stressing more on the emotional or on the mental health part, because when you do CPR, there's a sense of humanity in you, that you want to care, that you want to actually save lives. But mind you, not all who that or not all who had cardiac arrest will be resuscitated successfully. So baka naman dalin mo siya in the future na parang, I did this but I didn't but the patient did not survive. Globally, it's just 10%, 10 to 15% for out of hospital. So it's not it takes a toll on you when you do CPR, but you should be mindful of that, and you should be ready, emotionally and physically ready to do CPR.
And I'm sure for some people and Good Samaritans, as you call them, they may have found the person, like, already an hour past something, or the timing there is in it too, but they still try to do their best to save a life. And I understand how, I mean, I'm not a doctor, but how I can understand, I don't know from personal experience, that how intense that is. No, so thank you for advising the people who want to learn CPR about that. I guess that's also your, giving the risk is the benefits outweigh the risk. Even if a bone cracks or is broken, it's not fatal, as you said. It's better to get someone's heart, the circulation going, the heart pumping, and it's better to save them and then deal with the cracked rib or something later. It might not even happen, but it's a risk that you have mentioned and put out there. Do you have any final words you'd like to say, doctor? Say hi to anyone also, or anything else you'd like to emphasize?
I'd just like to thank Nicole and the team for having this platform to really educate and our people or our listeners regarding the importance of CPR, because as you know, CPR saves lives. It's not just a slogan, but it actually saves lives. No? So I think that will be my final words for today. Thank you very much, Nicole.
Thank you, Dr. Castillo. It was a pleasure having you. Please come back anytime and discuss any other thing you'd like. This is a platform for learning with the latest health and medical updates. And you have an update CPR. People probably think, yeah, I know that already, or I'm vague. But there's an update on it, especially after COVID, and there's new guidelines. So it's great, when the most basic even of technology, it's not a technology, but it's a technique. Even when there's an update, it's great to hear. Thank you, doctor. We also update our playlist of songs we can think of. Thank you, doctor, for being a good sport on the show, for being interesting, for taking the time and effort to demonstrate, and for being interactive with me and the audience. That truly was an interactive experience. And thank you, folks, for tuning in. And remember, if you want to learn more about CPR, you can go to the sites that Doctor mentioned, the American Heart Association, and there are also training programs out there, I'm sure, in person. And of course, you can watch the show to just, keep remembering and all of Dr. Castillo's advice. Thank you, Doctor, for being on the show.
Thank you. It's our pleasure.
Okay, see you guys next week on Healthline with Makati Med. I'm your host, Nicole Jacinto, and see you next week. We're out for today. Stay tuned for kakampi Bernard Tan.
Thank you for tuning in to Healthline with expert doctors from Makati Med, giving you the chance to interact, uplifting your lifestyle. Moderated by Nicole Jacinto. Tune in again next week for your weekly dose of Healthline.
The views and comments of the hosts and guests are not necessarily